That's uncomfortable, very uncomfortable. I've tried it. I tried just to. I'm on a auto pat myself because I have central and I have mixed apnea, central and obstruction due to a head injury. So I'm not supposed to be here doing this kind of stuff.
Oh my
I'm
God.
supposed to be stupid and dumb.
Wow.
I was 18 months old when that happened to me. I fell down a flight of stairs.
Oh, wow.
Hit the back of my neck. These gray streaks right here, I've only had those since I was 2 years old. Yeah. So I've had that. Yeah. They told my parents I would never amount to anything like that. Yeah, I was 6 kids. Only 2 of us have a college degree. Hello?
And you're one of them.
I'm one of them. So, my mom always said, never underestimate BJ. Yeah. And if you ever heard of Scott Hamilton, the ice skater, he has a quote. The only disability in life is a bad attitude. Remember that. I have a t-shirt that's done. Okay, all right. So, not sure if any of you have any of my patients. I know you did at one time. We lost Scott. He had this type of heater. Yeah.
I remember you did now.
Yeah.
And you had a Vanilla Bynum.
Vanilla Bynum too. I miss her.
I remember.
Yeah, her too. So, exactly. And you've seen them with this heater.
Yeah.
This is the Neptune heater. We are the only ones in the DME world that is authorized to use this in the home care. Before Medline bought him out, we were doing services with Hudson RCI. So during the pandemic, when nobody could get circuits, we did. We had the circuits from pediatric to the adults. These are the adult circuits, and the majority of our kids are now on adult circuits because of this mode of ventilation that's on their vent. So it's a great heater, and it comes with sterile water as well. We get it's the only one because the other ones have bags. Well, Medicaid is, I mean, a lot of DME companies are stepping away from that because those bags are anywhere from $5 to $7. Our water bottles are $1.25. So we're going to get what we can. And Medicaid stipulates that we do need to give sterilized water for tray fed kids. Adult, whatever, but for pediatrics and child, babies and all, sterile inhalation water. So we use this heater. It's also temperature regulated and we call it rain out. It decreases the amount of rain out, but it gives you the humidification. Okay? So this is the circuit. It doesn't matter what bench they are on. A circuit is a circuit. It doesn't matter unless it's the LTV 1150. Okay. All right. One thing you need to know about this ventilator, there are 4 filters. Literally 4 filters. You have your air filter, which kind of looks like, look at the LTV 1150, you had the air filter and the fan filter, right? Air filter and fan filter, which is slightly bigger than what the LTV 1150 look like, okay? These get changed every 6 months but cleaned periodically, okay? You don't want to get them really dusty and all because it can overheat the vent, okay? Now, there's another filter on here, which I despise, and I'm not going to lie to you, is turn this filter. I have this filter here. If that filter becomes dirty and you can't get a clear, where you can't, what do you call it, calibrate your circuit. If it keeps failing and that circuit's dirty, the vent needs to be changed out. Because the only way you can change this is by using a torque screwdriver for a certain torque. And it has to be done. At first they were telling us we had to send them to the facility. And then we found out we could buy the filters and do it ourselves, which we do. And then we have to retest it again to make sure that the circuit is good, that it will give you a pass on the circuit. Now sometimes, that's clean, it can not give you a pass on it. So it's just very finicky. To me, it's something that I don't see really the need for it as long as it's working. But I've gone into a foster home 3 days after they had this ventilator. This was brown, this was brown. Now, the back filters were clean. So that tells me it could be internal. But we still have to change out because I wouldn't want my child on that. Not me. So when you put this filter in, now when we come out to check it, if it hasn't been changed, the respiratory therapist can change it. They always carry one with them if you have one with it. Okay? But it has to be locked in. And you'll feel like a little click in a way. You won't hear it, but you'll feel it. That it's locked in. Because if it's not, it's going to show a circuit disconnect. Okay? All right. Oxygen bleeding right here. Just like any other vent. So this vent was designed by the guy who invented the trilogy and the EVA before he left Esperonics. But he couldn't do that auto-track and auto-track sensitivity because there's a patent on it. And Philips Esperonics will not give up that patent because they still make them overseas. So they're still available. We send for service all the time on them for preventive maintenance because we can. They're not obsolete, they're just discontinued. The EVA's not discontinued, but the trilogy is. But still usable. Yeah. Even though the doctors don't think it because of a recall on the CPAPs and the bypass. But FDA gave them approval to continue working on it. So, okay, it comes off the stand. I hate this because it screws on. It's your power cord. It literally screws on. We have not been able to find a car adapter for it. We've been searching and we have not been able to find a car adapter. So there are 3 batteries, 2 detachable ones, one on each side, and 1 internal. So these are your detachable batteries, and they can stay in there. Okay, you hit that little button, it'll tell you how full it is. Okay, there's 1 on each side. Now, like any other ventilator, if you go to your battery mode, you're going to go to your detachable battery first before your internal battery. Okay? Also, remember, hurricane season coming up, right?
Yes.
If you have this vent in the home, please note that if the electricity goes out and they're draining this all the way down and they don't have a generator, which we always try to encourage the families to get some type of generator. So, because if they don't, it's going to deplete the battery life, and then it's going to drain the battery life completely because there's a maximum of 9 hours only. Yeah, it's probably the worst next to the LTVs for internal batteries. Okay, but if it depletes, you will lose everything, your settings. It'll go back up into factory default. Yes, and it did happen to one of my kiddos. She was the first to go on it, referral came through. And we pick up her LT 1150, which is great because Mom already had batteries and everything charged just in case. Well, this one drained all the way down to it just shut off. And thank God she had the LTV 1150. So, because we weren't going to pick it up until we were prepared. And she went to charge it. Grandma went out a generator and she went to charge it and went to turn it on and lost everything. She couldn't use it. We had to go back and set it. And she said, "Oh, now get this thing out of my house." Yeah. But now she's on it. A year later, she's on it. But that is a big warning about battery on this. If you have the Trilogy, the EVA, any other ventilator that we have, you don't lose that memory. All this still stays in. Even your time and all of that still stays in. For some reason, it stayed in. But as long as you're at home, keep it plugged in. Okay? This is bigger generation of the LT 1150 charge power cord, surge protected power strip. It goes directly to the wall. Do not use a extension. Yeah, whether it's a regular extension or whether it's a surge protected power strip, do not use it because it will deplete battery life. Okay, the longevity of the battery. Okay, yeah. So, and you don't want to do that.
All the memory's gone.
Huh?
You said all the memory's gonna be gone.
And that, it didn't make any sense, does it? It does. I mean, that marked out, and I don't blame her.
Even with the upgrade, you would think.
You would think, but no. It's the only one. I've been dealing with ventilators for 24 years. That's the only ventilator that never lost any memory or anything like that. So, but, go ahead. So what she's giving you are tracheostomy care. This is actually from Texas Children's. It's online, and it's really good to have because you can learn your tracheostomy care in the home as well. So it's really beneficial for you. So, can you want to come on over a little bit more to see? You're fine.
Yes, thank you.
You're welcome.
Yeah. Are you gonna be able to right there? No, Miracle. Maybe you can.
Huh? She can
Can
come
she
over
sit
here.
right there, right?
Yeah.
There's a seat right here too.
Oh, there's a seat there. You can sit over
Thank
there. No, your baby.
Don't sit by me.
Oh, your baby.
Yeah, here. Thank you.
You're gonna move along over there.
Yeah. All right, and give her a check sheet too here.
The name and phone number. Thank you.
Got it?
Here.
Okay? Alright. I will say, this is touchscreen, and yes, you can use stylus on it. You can't use a stylus on the Evo. It's touchscreen. You can't use a stylus on the Evo, but you can use stylus on this. Which I confirmed that you can do that. Okay? So it is all touchscreen. Okay? So, sir, this particular so depending on the company, whatever they have, their circuit may be different. But for the most part, this is what we put on. Okay?
Uh-huh.
Have I put this on?
Yeah.
Okay.
You want me to do it now?
Are you going to put it on, like, put it on so it
All right. So I'm not going to put it in charge. Yeah. Up until last week's been charged. I'm not coming to the dead vent. Not. The batteries to be charged. All right. Your alarm set button. Your power on. This is Allison. Allison was a patient of mine. She did SMA1 back 3 years ago. She was 40 years old in 4 months. They normally don't live that. That's spinal muscular atrophy. Did. So Dad said, here, take Allison with you. Okay. Right now, we're going to put it in a standby. Yep. I'm going to put it in a standby mode. Okay? So, to get you know your adapters, The only way you can do this is, I know it's battery use. Okay. There you go. Okay. That's it. Okay. So, isolation valve. Yeah, I've seen this on the trilogies and evos for passive circuit. There's three different types of circuits for this: passive, valveless, which is for a mask, or sip and puff, mouthpiece, where somebody puffs on it with their mouth. You know, a lot of muscular dystrophy kids use it on their trilogy evos, where they have a sip and puff. But I haven't seen it on this one yet. It's just passive circuit. We're having a hard time non-invasive with the mask using this, the flow trigger. Okay, exhalation valve down the circuit. Okay, this is your T adapter. I like using these blue T adapters because they're stronger and they don't crack, they don't break like the plastic ones. The white ones kind of, if it gets too hot, it will kind of misshape them and you could get a leak. So we use this. You have a choice of either putting it here or here. So I prefer right there because your isolation valve, you want it as close as possible to the patient. This is your HME, heat moisture exchanger. We use this one because Texas Children's uses it. And not only that, it's foamy. There are some that have a paper on the inside, and if a mucus plug gets caught in there, it can ultimately give you false alarms. Or patient will have a hard time breathing it because it's restrictive. Whereas on this foam, the mucus actually breaks up. So this is why Texas Children use it, and this is why we use it. So, okay, here, and you only use this if you're traveling or if the electricity is out. Okay, so, all right, and we'll put Alice here. All right, questions so far on this? If you don't have this here, you could get a really weird alarm. Okay, so make sure your isolation valve's on it, especially if it says passive circuit. Okay, if it says valveless, then that means this is not there. Okay, all right. Temperature probe for the heater, a heater right here. There is a column right here. The bottle of water will go right there. Okay, but I'm not worried about that right now. It's just I want you to know this. Okay, this has nothing to do with this, but all to do with getting humidification to the patient. Okay, nebulizer. We never. Now some companies don't put the nebulizer up here. The nebulizer cup up here. I don't get it. Thank you. Thank you. So these are two of the nets we use. These put out a very fine mist of medication. Kind of like the aerogens that we use in the hospital that some patients use at home. That's what these do. Very fine mist. You can put it down here or you can put it right there. Patients aren't going to choke on it because it's very fine. It's not clumpy medicine. Okay? So right now I have a standby. I'm going to hit standby. And then this is the menu. And if you notice, everything locked in. If it's nothing on these, that means the is locked in. I go and unlock it by putting in a code, which the last four numbers of the serial number 4168. 868. 68, except now it's locked, unlocked. I typically don't like to leave them locked because there's always a chance of changing something that you can do if you need to. Okay. Device settings. Unlock required. I go all the way to chat and go down and hit no. That way it's already unlocked. Okay. It's showing that alarm volume is low, different low, medium, high. So then down, you heard Krista that was low, medium, and high. Yeah. Okay. All right. Everything else, I don't need to worry about any of that. I'm gonna exit out. I'm gonna go to monitors. Everything that you see right here is what the patient's doing. Okay. Now, if you scroll down the arrow, everything you see here is the patient settings, where you don't have to go to the main menu to find what all settings are. You see it? It's a small screen that's made. But this is what they're doing. Now, if we have to change anything, we can customize it. So some of the patients I saw, some of ours that I went to visit, I saw that the max pressure support and minimum pressure support was missing. Well, you guys have to document that. So I had to sit back and find out what was going on. And found out, yes, you can set that by customization. And then I had to show the respiratory therapist all of that too, because they weren't doing that in the hospital either. So nobody thinks about the nurses. Nobody. So we need to step back and make sure everything is correct before the patient goes home. That way you can see what they're doing. So this is their settings. We got volume targeted pressure support, which is the same thing as AVAPs. But they can't put AVAPs because of the patent. So now it's volume targeted pressure support. Mode, that's the mode. If I want to customize that, I hit edit. This is, I can add these here, except, or I can go ahead and exit out and go somewhere else and look at it. But right here it says VTSP, volume targeted pressure support. And you can go to your monitor. If you go to your menu, you can go to your settings and alarms, and it'll tell you have 3 presets. You got 1, 2, and 3. That's if you have a different mode during day and a different mode at night and whatever. Now, the only one that has a massive amount of different modes is the Evo. It has at least 8. Yeah. Trilogy only has 2, primary and secondary. This has 3. LTV doesn't have it. You have to eliminate something. Okay. And then there is also the ResMed Astro. They're not really big here. They are in San Antonio, Austin, those areas right there, because they would rather use the Astros than to use this. And I agree with them. I would rather use the Astro than this. Yeah, only because it's quieter. Like your Trilogy and your Evo are very quiet. This is about the same sound as an LTV 1150. Sometimes it can be a little louder. Sometimes it can be a little quieter. Just depends. So, preset 2, adult circuit, humidifier, and you see whatever is highlighted, that means we can change. But if it's dim, you can't change it. Okay, what's the set? Okay. But if I want to change it to an HME, all I have to do is, let me get out of there. Let me get to that first. Okay. If I wanted to change it to that, I just scroll up and hit humidifier, edit, add the HME, accept, and then exit out. Now I'm in HME. So you can do that for travel. And that way it bypasses when you have to take off your travel circuit. And travel circuits are travel circuits. We like to use the CPAP tubing because it's better quality than the travel circuits that anybody else gets. Stretches and it cleaned. So if I wanted to use a travel circuit, I could set my alarm and then do the same thing as you would your regular circuit. Always remember, if they can't come off the vent very long amount of time, then oh, and don't ever use the nebulizer within because they tend to breathe in faster. So and their eye time is higher because they need more time in but less time in. Okay, so depending on their and then we have apnea. And the only good thing about this one, at least apnea doesn't alarm if they're shallow breathing, only if they quit breathing. That was one of the good things about it. Whereas the Trilogy and the Evo, you have to, you don't even set those alarms because they will start alarming if they're shallow breathing, if they're riding the vent. Okay, so like this patient right here, Allison is riding the vent, unless I do this where I'm breathing for her. Okay. Minute ventilation, breath rate, high and low, inspiratory pressure, high and low PEEP, low PEEP, high PEEP, circuit disconnect, high pressure alarm delays. Those are not a whole lot of alarms like Trilogy and Evos have. They have a little bit more than what anybody thinks. So, okay. So, questions on any of that? No? Okay. Yep, it failed. So that means it's only going to do it with the regular circuit. And you have the isolation valve off. It will not at all. I don't I really don't see the reason for doing that unless there's a problem. You're changing it from a pediatric to an adult circuit or from an adult circuit to a pediatric circuit. And we, for the most part, we don't change our circuits but every other week. Because if you continuously changing your circuits, you can instill bacteria or germs by keep changing it. That's why we do the sterile water as well. So, and my pet peeve, oh, I got condensation in here. Let me shake it out into here. No, don't do that. Never ever dump your condensation back into your humidifier chamber or column because you're instilling bacteria. Okay? In a wastebasket, in a glove, it doesn't matter. Don't do it in here or the chamber that you're using. Okay? So, questions so far? Okay. Monitors, everything that the patient's doing, waveforms, like it really matters. But some of the pulmonary doctors like seeing that waveform. Yeah. So, okay. Exit out. Whoops. Home. Therapy. So if I want to change it to this one right here, which is my other preset, I can hit that. And I think this is because it's got a different mode of ventilation on it. So I want to go see what that mode of ventilation is. And it's got a tidal volume 450, but look at that pressure support. It is really high. You know, right. And you will be surprised how many patients have that high pressure support. So, the thing is about the settings, the reason why they do that is because it's all about their diaphragm. A lot of the patients that are mainly on the vent because of neuromuscular disease, SMA, ALS, and it's their diaphragm that's not working right to make their lungs breathe in and out. So same with CPAPs and BiPAPs. It's not just about obstruction. It's about their diaphragm too. If it doesn't work, the patient's not breathing normal. So That's why it's very important that pressure, they see pressure as being the main thing. I don't think I've had more than 3 or 4 patients out of 170 that are on SIMV mode. Yeah, they're all on some type of pressure mode. Yeah, SIMV, I think maybe less than 10, if I'm not mistaken. And some of them are on the LTV 1150. But some of them that are on the LTV 1150 are on pressure mode. So, yeah. So, right, you would think the 1150s would be discontinued. Those aren't going away either. They're not. They're not. So there is one physician at Texas Children's, Dr. Farber. He's pulmonary, and he is all about the LTV 1150s, the Astral, and the Trilogy and Evo. He doesn't like these. He will fight. Don't ever put one of his patients on this. He will throw a fit. Yeah, they try to do that
connection.
because it's only flow training. And these kids are auto track, yes. We want them to breathe on their own. You know, help them breathe on their own. Why make them suffer with? So we were trying to get her on the LTV 1150, which she would have done just as well on. But another one was in a foster home, and him, same thing. CO2, he had CO2 issues to begin with. So they finally had to put him on the Trilogy Evo because this was not doing well for him. They couldn't get his CO2 down past 50. Yeah, yeah, exactly. So it's not a fit for everybody.
Yeah.
Now, if this patient is new to the trach and to the vent world, then yes, because they can manage that.
Yeah.
But for the most part, there's even a few that can't manage it. So it just depends on the patient, the disease process, and the vent. Yeah, exactly. That's what I say. Wow. Well, I have never been a big fan of it. They were trying to pass the Voxen off at muscular dystrophy camp one year in 2018. And the parents came up and asked me what my thoughts were on it. And I said, well, I'm going to tell you right now what Dr. Farber will tell you. No way in heck are you getting on that vent. Because not everybody's on oxygen. Not everybody's on a cough assist. Not everybody uses a nebulizer or whatever, you know. But it's right. You would have to have a very ill person on that vent. And it's not worth having it in the event that anything happens. you can hit your alarm reset button. There you go. I depend on you, so that's why I give more of the training now than just going to see patients. So, yeah, the top, when you go to monitors, the top screen, the bright screen, is what the patient is doing. Go down the arrow down on the bottom, and that's where that's all the patient's settings. Okay? Those are really important. Those are the main settings that I prefer that you see because that's what's showing up on the other screen. But we can also customize it to seeing something different. Maybe a PIF or peak inspiratory flow or PIP pressure, see what that pressure is. We don't necessarily have to show what the title, what the mode of ventilation is because we already know because it's on the top of the screen. So, but having to show all of these is really important to y'all for documentation. So how often do you document on your
Every 2 hours.
every 2 hours, which is pretty much a Medicaid guideline anymore. So that's good, knowing what the patient's doing. Exactly, what they're doing, because it changes from time to time. They may be doing something different during the day, but when they're asleep at night, they're riding that back.
Yeah.
So what happens when a patient has a mucus plug or thick secretions? What alarms would you see on this?
High volume. Is it?
Exactly, and what else? High inspiratory pressure. You may see a high PIP, peak inspiratory flow, or peak inspiratory pressure. So that would tell you anything that goes from that trach to the vent, that trach is included. It's considered part of the circuit. Okay? Always remember, even if there's an inline suction catheter, remember that trach is part of that vent circuit. So if anything happens to that trach, it's going to feed off on the vent. Okay? Humidification is everything, whether it's an HME or whether it's heated humidification. I mean, we breathe through our nose, right?
Yes.
They can't breathe through their nose. They're having to breathe dry air. So why breathe dry air when you got humidification? Unless when it's dead outside in humidity, breathe that in. But
You can change the language on this?
yeah, you know how many languages?
No. Just one? So
Just
Spanish
one.
only?
No.
Which one is it?
It's some type of Chinese, Japanese, or whatever it is.
Mandarin.
I don't know what it is. But that's the only one. All the other ventilators have 20 languages. This
Oh,
doesn't.
it's Mandarin.
Yeah.
Is it Mandarin? Okay.
And they're,
Yeah.
wow, really fun too.
Yeah. But that's the only thing.
Has only one language?
English and Mandarin only.
Mandarin.
Yeah.
Yeah.
I guess
I mean, I guess you can do,
Mandarin.
I guess because it's characters versus like, you could possibly put English words into
But you know what? LTV 1150s have 20 languages.
things.
Astros have 20 languages. Trilogy and Evos have 20 languages.
This is the only one.
It's the only one that I know of on these vents that only has a Mandarin and English, which doesn't make any sense.
They put too much other stuff.
Too much other stuff, exactly. Yeah.
Let me ask you a question. Is breathing there.
SIMV standardized intermittent respiratory ventilation, which means they're breathing on their own, they're getting assisted breath, but they're also getting a mandatory breath in case they need it, which is kind of riding the
Well,
vent.
when they have the breath rates.
So
So
that's
you
their
set-
mandatory,
Yeah. And
and
then add their.
as needed and mandatory, yes. So but when they're breathing on their own, your frequency, the F on the LTV 1150 stands for respiratory, how they're breathing, okay? On the vents, it's the Trilogy and the Evos, and this one, it's your respiratory rate, okay?
What's this vent? What is the name of this vent?
The V home
Oh.
is the V home. It's made by Voxen. Boxing is actually made by Ventec. And Ventec is the one that came out with it, but like I said, we don't use the actual Boxing. To me, they should have just taken that off and put V-Home on it. Because it confuses everybody thinking that it's the oxygen, the ventilator, the oxygen, the cough assist, the suction, and the nebulization. So, but it's not. It's just the vent itself. So, and React Health was the one that actually started carrying it when they designed it. And but all of those sales reps from React Health got fired, except for one, and he quit because they were putting the whole load on him. And then so they have literally no reps for this vent anymore. So it's all put up on the DME companies. Some of the hospitals don't even carry this vent in the hospital. The DME company has to bring it in for them. There are a few, Texas Children's may have a few in their NICU, but when it comes to their legacy tower, which is their TICU, which is transitional care, or the PICU, the 11th and 12th floors, for the most part, that's where the DMEs come in and bring their vents. Even in NICU, once they get transitioned on. But for the most part, they don't really have these. They depend on the DME companies to bring it in. So.
Yeah, one of my patients just.
So the name of the vent is
V-Home.
V-Home.
The company is
From
Boxing.
LTV 150 and they.
1150. Who is that?
One of my patients just transitioned from 1150.
Yeah, 1150.
1150 to
Yeah.
this V-Home.
Yeah.
And the DME had to bring it into Texas Children.
Yeah, and we've done that too.
Yeah.
We've had one patient switch from an LTV 1150 to the Trilogy 100 to the Trilogy Evo, and then to this.
Wow.
Are you kidding?
I know.
That's a
Yeah.
lot of change.
That's a whole change for this kid.
Wow.
I brought him home as a baby on the LTV 950. If y'all remember what the 950 was. The 950, that's obsolete, okay, literally obsolete. 950 had a PEEP valve, what do you call it? External PEEP valve. 1150s already have an internal PEEP, right? So the 950s had an external PEEP valve, and you had to adjust that PEEP valve and add it to the pressure support when you programmed it in. But now on the 1150s, you see pressure support plus PEEP, or PEEP plus pressure support. You don't add that PEEP because it's already added. You just have to know that when you see that PIP on the tickler, you have to know that that's the PEEP and the pressure support right there. So, what's the difference between pressure support and pressure control?
Pressure support is well, one sounds like it's helping, and one sounds like it's doing the work.
Bingo. Pressure control is doing the work. Pressure support is helping, which means if you have yes. Think about it. When you're on a CPAP or a BiPAP machine, you have an inspiratory pressure and an expiratory pressure. Okay, which your inspiratory pressure is pressure control, not pressure support. Your expiratory pressure is your PEEP. Okay, regardless if it's non-invasive or invasive. Some patients are on these just for BiPAP with the backup rate, with AVAPs, or here pressure, volume targeted pressure support. But there's also volume targeted pressure control with pressure support as well.
Because you can have both going at the
Yeah,
same time.
yeah, sure can. It's crazy, isn't it? Modern technology, guys, I mean, it's come a long way in the last 20 years. Because back in the day, it was basically the LTV 950s, 900s, or the 800s. Those were the big vents back then because they were, do you know what LTV stands for?
Yeah.
Laptop ventilator.
Okay.
Not long-term ventilation.
Like lungs or something,
I was at Texas Children's when the first patient went on the LTV 1000, which was a hospital one. Sophia was her name. No arms and no legs. Beautiful little girl. And they put her on that 1000, which was a hospital. They wanted to trial her on it before they would send her home on the 950. And that rep is a rep of mine to today, and that was in 99. So I've known that rep, Max Elise, for years. Very first rep I've dealt with in the home care. Yep. So he put her on that. He didn't tell us that on the circuits you have the two tubings at the top, one yellow and one white. The white is for triggering the yellow, inspiratory and expiratory, the flow. If you have it turned upside down, water can get into that line, causing problems, causing erratic readings on the vent. So you have to make sure that those two tubings are up. And not only that, they're stabilized. They don't twist or anything like that. You break one of those, that circuit's done gone. Can't use it. It can either severely inflate the lines or severely deflate the lines, if there's even a little crack in it. Yeah, but they're still available. Not the 9, 8, 9, or 950s, just the 1100s or the 1150s. They have a newer one out, but they don't want to touch them here because it's, to me, when you look at it, you're thinking it's a hospital vent because there's just so much on it. So we want to make it easy for you guys to understand, to know what you're looking at when it comes to these vents. The pressure support, the PIP, the peak inspiratory pressure, which basically is your high max of your pressure. Even if it's pressure support, but if it's pressure control, they're not going to go over that certain amount. So, but pressure control, pressure support, mean airway pressure is your respiratory rate and your tidal volume. That's how you get your mean airway pressure, you map. Okay, that pretty much keeps it stabilized. But when you're having problems with your tidal volume because of mucus plugs or mucus secretions, you're going to see a difference in their high inspiratory pressure, your peak inspiratory flow, your PIP, your exhale, more of your inhale tidal volume and somewhat of your exhale tidal volume. Because your inhale tidal volume is at the end of inspiration. And then at the end of expiration, before it goes back into inspiration, that's your VTE, okay, which is your exhale tidal volume. So it's exhale tidal volume this way. Right. So exhale tidal volume. So once it gets slow to where before it starts going up again, that's when you want to monitor your exhale tidal volume. Because a lot of these vents are the exhale tidal volume, unless you have a certain circuit called an active PAP, which is what the Trilogy and the Evo and the Astral has. And an active PAP is kind of like what the LTV 1150 has, which is 2 extra tubings, one for breathing in, one for breathing out. That's your circulation of exhalation and inhalation. So you have that, but you don't get the AVAPS mode when you have. So I don't have any more patients on active PAP, on the Trilogy or the Evo or even on this. The last one with Allison, she was our last one. And it was because up in here, she wanted to hear herself breathe.
Oh.
Yeah. She had been on a vent since she was 6 weeks. Yeah. And Wallace. Yeah. Came to see her every 3 months. Because Memorial Hermann said there's nothing more they could do for her. She was 25 the last time she was in the hospital. Mm-hmm. Yeah, exactly. So, it's psychology, they want to hear that breathing. She ended up being on the Trilogy. She had very old ventilators that Dad donated and we sent over to third world country for them to use. But they're quiet. This one is not as loud as a couple of the other ones that I have in my office, but it's about the loudness of an LTV if it's one that's been preventive maintenance and all that. So also on the LTV 1150s, if you hear a clicking sound on the end of expiration, That's the vet. There's nothing wrong with it. It's just a pain in the butt. But I still got maybe 15 of those out.
Okay.
Yeah. Kind of scattered all out throughout Houston and Lake Jackson. Angleton. No, not Angleton.
Arlington.
Bay City.
Oh, okay.
Bay City. Yeah. We have a SMA 1 male that will be 30 this year. And he's been on a vet since he was 2 years old. Oh, I got water.
Oh,
honey,
you want
thank
water?
you. Yeah.
You're
I always have water with me.
So I always have this
Are you
question,
talking?
Sure.
my concern all the time. Assuming a patient is on this V home or LTV 100, and you're looking at you have a range of the VTE, right?
Mhm.
And then you have a range that you've always seen that is a map and the pressure support is
Right.
constant, things like that. So assuming the patient has a lung problem and it's
Right.
not mucus plug or anything,
Right.
it's still internal. How
Right.
do you indicate it before it gets to
Okay, so let me
Like, how do
explain
you
to you
get
when
it
it comes
from
to
the-
lung issues, predominantly lung issues, they are gonna go on SIMV mode. Whether it's assist control SIMV, assist control, control ventilation, they call it control ventilation, or SIMV, control ventilation. SIMV is more patient triggering. The difference between, even on this, if I put somebody on assist control on this, which we do have a patient on assist control on it, assist control does not give you pressure support. Remember that. And SIMV and control ventilation, assist control does not give you pressure support on any ventilator, including the ones in the hospitals. Okay? None of those ventilators will give you pressure support. Only on SIMV or CPAP, BiPAP, or whatever you want to call it. Okay? Any type of pressure, whether it's pressure support or whether it's pressure control. Assist control will not give you pressure support, regardless. Okay? So don't go looking for it. Okay? You may be able to pick it up with your PIP. That it will show that, or the PIF, peak inspiratory flow. It's going to show you those readings, but you're not going to have a setting for it. Okay? If you go on pressure control on this one, even though pressure volume targeted pressure support, which means it's just a targeted tidal volume. And that pressure support, with the minimum and maximum, is how you get the readings on a tidal volume. Do you understand what I'm saying? So your pressure support has everything to do with that tidal volume. But they're not actually getting volume. That's just a reading that the doctors want to see their volume be at. So when they first came out with the AVAPs, Texas Children's was all over it. We were putting those trilogies out in 2010. My first patient went on one in 2009. And when they found out we were putting them out, we didn't know we had to have a prescription to change the ventilator. We were just changing them out. But they noticed that the patients were doing better on it because of the type. You can do with side. Okay, you know what I mean?
Mm-hmm.
And then you also have a ramp or a square. Do you want to go up, breathe in, breathe out, or do you want to go? I would rather go a ramp than to go a square.
Yeah.
Okay? It's really hard to go to a square unless you're really in what we call control ventilation. And I only have one patient in a control ventilation because she could not breathe on her own. She passed away at 32. She had severe muscular dystrophy and scoliosis. And the only ventilator that had control ventilation was the Trilogy 100. And she tried to breathe out, and she just trying to breathe on her own, and she couldn't do it. And trying to tell her, you can't breathe on your own. You have to let the vent breathe for you. Ventilation, again, mistaken, that didn't give her pressure support either. It gave her PEEP. PEEP is really important, okay? It's at the end of exhalation. How much pressure is left in your lungs? How much pressure do we want left in your lungs at the end of expiration? That's what PEEP is. I've gone into a home where a patient was transitioning to us and he was on 1150 on CPAP. So I go in and I'm looking at the settings and I ask the nurse to turn it on. And I'm looking, there's no settings. The only thing that was set was the alarms and sensitivity. So this other comes in and wants to know what's going on. And I said, "Have you have problems on this bed?" Every night he fights it. I said, "That's because he can't breathe. There's no pressure." "What do you mean there's no pressure?" So I took a glove, put it on that circuit, turned it on. Nothing. Nothing. He can't breathe through that. Nothing. So I set the PEEP and the pressure support both at 7. And he still did not like it because he had it in his mind that this vent is not working for him. So 3 weeks after signing him on, we put him on the trilogy just to trial it. And he did great. He didn't even know he was on it. He did not. He slept for the first time 24 plus hours straight. Yes. So it helped him out. And he's still on this trilogy. And this was 2012. And he's still on the trilogy. Yeah.
So
And he's still with us.
So trilogy 100 is for patients that cannot breathe on their own.
Excuse me now?
So trilogy 100 is for patients that cannot breathe on their own.
No, absolutely not. Trilogy is for anybody who's trached and needs a ventilator for support.
Okay.
It doesn't have to be. There's 14 modes of ventilation on a trilogy.
Oh.
14.
Oh,
4 of those modes have AVAPs with it, with or without it. Yeah, 14 modes. This is one of the reasons why we chose to do the trilogy. Because of all those modes of ventilation, because we're seeing the difference in these kids, because Texas Children's finally caught on and they're seeing the difference on these kids. A lot of your neuromuscular patients, ALS, SMA, muscular dystrophy, there's 42 types of muscular dystrophy. That y'all didn't know that, did you? Yes. I'm all about Muscular Dystrophy Foundation and SMA. I go to muscular dystrophy camp just about every year. So I know what it is, what it's like not to be able to breathe, what it's like to.
So in that camp, everybody is with ventilator.
Not everybody. Some of the families are like, no, why take away something that works to get something that may not work? Do you see what I'm saying? Parents have a right to anything like that. They don't have a right, doctors don't have a right to say, no, if you don't want to go in this vent, then go somewhere else. You know what I say? Bye, bye, bye.
Yeah.
There's plenty of doctors around here.
Yeah.
Plenty. It does. And we it doesn't make any sense. Why pick it up when they're not doing well? Just because they're in the hospital 24/7. You don't know what happens that night when they go to bed. They may be doing great during the day.
Right.
But when they fall asleep, you don't know that. Because you gotta start seeing things that they weren't seeing because nobody was really watching.
Yeah.
Okay? You think that they're gonna be in the room 24/7 at the hospital watching this child? No.
No.
Exactly. Okay? One of the reasons why I don't work in a hospital, because I'm very choosy, I'm very selective. No, don't do that. I mean, I fight for our patients' rights. My company, the president of my company goes to Austin all the time, fights for these kids. We have to. Fight for the nurses. We have to. I depend on you guys. They don't pay me to sit 8 to 12 hours a day in the hospital, in the home, to take care of a vet kid. If I did, I wouldn't be married and I'd never get any sleep. I'd open me a big facility and say, any nurses want to come and work for me? But a lot of foster homes. Do you guys deal with foster homes? Okay. Well, we have a lot of foster homes. In fact, actually got signed on with more foster homes since Arrow Health. If you've heard of Arrow Health, it's another DME company that was opened up by Arrow Health Ministries that has adoptions.
Is it Arrow Foster?
Yeah,
Yeah. Okay.
Arrow Foster. Yeah,
Yeah.
Arrow Health.
Yeah.
The state shut them down.
What?
The DME company.
Oh, they did.
DME company shut them down because they were billing for stuff that they weren't approved for.
Oh.
And all they were, yeah, exactly. Everything's coming down to the wire with money and all that. It's coming from help. It's taken away from you guys. It's taken away from us. When I first started DME, these circuits, this water, these adapters, everything that went on that vent to the patient was purchased through from Medicaid. Then all of a sudden it got, well, we're taking 20% off, but we're only going to pay for the vent. If you want, and the sterile water, that was it. If we gave them sterile water, we had to prove why we had to give them sterile water, why not distilled, okay? So then it got to where it was just, everything was included with the rental of the vent. The only thing that's not included is the trach tie, the trach, the inline suction catheters. Everything else,
So one payment for
everything except for all the adapters, with the exception of the medicine cups for the nebulizer. That we get 2 of those a month. They brought down so much.
Yeah.
Years ago, it was only 8 trach ties or 10 trach ties a month. Now the max is 20 unless you have a detailed letter of medical necessity. Why are you going over the allowable to 30? Because on the package it says, do not clean or reuse. Hello?
Yeah.
You would be surprised what parents have to go through. Some companies are still giving them 10.
Wash the trach.
Oh yeah, Allison's dad made the nurses wash all of them in the washing machine on the delicate cycle.
Air dry.
Yeah, air dry it. Yeah. Yeah, it's crazy. And when she passed away and he donated all these supplies, I had a big box of trach ties. Because he was saving them. Because you never know. You have it in your mind that something may happen and you're not gonna have anything. Yeah. So a lot of things have been changed. And suction catheter. Be 120 a month. Down to 90. Catheter up to 12 hours a day.
Sleep.
Yeah, that's why. And it has a little cup that comes in it where you can put water in it to suction through whatever. Inline suction catheters, unless you have a detailed letter of medical necessity, it's only 10 a month. Inline suction catheters can be changed out every 3 days. They do that in the hospitals for the most part. We went to 2 circuits a month besides the travel circuit because of the fact that we don't get paid for it. And we're using sterile water. So since we're using sterile water, the circuits are a lot better. They're, because they're actually getting in that sterile humidification. And these circuits can be washed by hand with distilled vinegar, all-purpose cleaning vinegar, or distilled vinegar and warm water. You can submerge it in for a few minutes and take it out and rinse it and hang it to dry. I had to put this on Facebook's PTFK Warriors, Protecting Texas Fragile Kid Warriors, back during the pandemic. Everybody was running out of circuits. We weren't. We had these. We're the only company that has these, so we had them. Patients on the LTV 1150, giving them the inspiratory limb on this. To change for giving them a travel circuit and putting this on the inspiratory limb. They can use it. Oh yeah.
So it
Oh, yeah.
connects
Even
all
with,
And
of
they-
them.
even with the electric circuit, you can watch that?
Oh yes, because this wire has a silicone wrap, so it's not going to short out like they did 25 plus years ago, where it was wire, whatever. So, and I had one mom that was doing it way before the pandemic. She was doing it because you go online and Google it. They'll tell you how to clean that. Yeah. And it's so the only thing you don't want to ever clean is like this one has this column. And then you have the other ones that have the chamber that has the water that feeds down into it. That's what we call an auto feed. That's what we do to bring that water down. But now companies are turning away from the bags of water and giving you a bag and have you pour distilled water in there. Right. Because those bags range anywhere from $5 to $7 a piece. Our water bottles are $1.25. Our Hudson RCI. So the only ones we can get the circuits, we can get the water, everything on it. Yeah. And we're going to use them. We've been using them since 2015. So it's been 11 years we've been using it. And it's worked a lot better. It saved us money because it's not just, it's about profit as well. It's about profit as well. That it's about making sure that the patient gets the best care where they're not in the hospitals. So some of my families aren't even changing it but once a month because we're finding out that every time they change the circuit, they're instilling germs and bacteria. And when you're using distilled water, even that auto feed, sometimes distilled water can still collect calcium deposits, depending on the brand that you're using. So let's just give them sterile water and be done with it. And take down, and yeah, these circuits are cheaper than the LTV 1150 circuits. Even the Trilogy 100, the white circuits, these are cheaper. Yeah. So we're thinking, Mark, just not profit, but also taking care of the patient. What matters most? Keeping them out of the hospital, because every time they go in the hospital, you don't have a case, and we can't get paid.
Yeah, so not using this.
Right, because you're not using it. Yeah. So we can't get paid for it. So being mindful and
So
everything.
if a child is in the hospital, you don't get paid.
Nope,
I'm not using them.
absolutely not.
Wow,
Yeah. Even if they take their own ventilator into the hospital,
Yeah.
we don't get paid for it.
Wow, I didn't know
We
that.
don't get paid until they get released, and then their delivery gets changed because they were in the hospital. Yes.
I know nurses don't. You know,
Yeah, and same with the nurses. Yeah. Oh yeah. Medicare. Oh my gosh. If you're a Medicare patient and you got your supplies, and a week later you go into the hospital, they recoup our money until they get back out of the hospital. Oh yeah.
everybody is getting
Oh, yeah.
reported.
Okay, so let me explain something to you too. What we don't drop ship our vet patients. We hand deliver every one of our vet patients except for one, and that's because the family, that's the way they want it. Or we have maybe one or two, and I'm like over 170 vets. Okay, only a couple of them drop ship. For the most part, we hand deliver. That's including their formula. Yeah. Yeah. Have you ever had a child that had stomach issues and kept going to the hospital because of stomach issues and found out they're drop shipping their formula and it's sitting out in the sun and it's sitting in your UPS or your FedEx van that does not have air conditioning? Do you know that liquid has to be 85 degrees or below in order for that child not to get sick? And one of my kids kept getting in the hospital with stomach issues. When I found out they were drop shipping, not from us, but from another company. Not anymore. She gets her everything hand delivered, formula and everything. And we let the patients know a day ahead of time that they'll be coming out with their supplies. What do you need? What you don't need? We don't just send it to send it. Because to me or to us, that's fraudulent. Charges are fraudulent and that was one of the problems with Arrow Ministries, is that their they were giving supplies and everything, and then trying to bill for something they didn't have authorization for.
Like the patient didn't even need those supplies.
Right, exactly. So we look to like, when it comes to this, what supplies do they need? How many do they need? This is not something, you don't have to change this out these are washable. 4, 4, and 2, sometimes 3 if they have a travel circuit, okay? That's what we give them, 4, 4, and 2 or 3. 1 or 2 of these, 2 of these. Okay, that way these are washable. Distilled vinegar or all-purpose cleaning vinegar with a warm water. Okay. Do you know how to clean a trach? If you're taking a trach out, and patient needs to hold on to that trach just in case until the other one comes in, because maybe they had a mucus plug. On the Bavonas. Can I turn this off?
Yeah.
Thank you. All right. I'm gonna turn it off. Hold on. Come on. You see what you have to do to hold on to? There you go. Okay. You hear the difference in the sound? I can talk a little lower now.
I kind of got used to it. I wasn't even hearing it anymore.
Yeah, you got used to it. Wait until you're sitting in the room quiet, and then
No, I've heard it in a
Yeah.
room quiet while you
Yeah.
sleep. I don't know. I guess I just kind of got used to it. Like,
Yeah,
it
when you
sounds
kinda-
like white noise. After a
yeah,
while.
it does. That's the way I see it. Yeah, but this one, I have issues with my left ear, so again, I have that constant humming sound.
Yeah. Okay. So
This is
I'm just-
even quiet than LTV 150.
1150 is
1150
it
is
is
even louder.
it is louder. Yes, but this can be louder too.
Mm.
But the Trilogy and the Evos and even the Astros are very quiet.
Yeah.
Imagine if you have a child that has noise issues, sensitivity to noise. Would you want them on that?
No.
Exactly. And we have a few of them. So this vent, okay, non-invasive with the mask is fine, but it is not, how would you say, it will not accommodate a patient with a RAM cannula. Do you know what a RAM cannula is?
Yeah.
It's a high flow nasal cannula.
Okay.
They can do CPAP or BiPAP or a high flow oxygen with it. Through the vent, because of the mode of ventilation, their age and their weight, can use a RAM cannula, mask, or whatever. So this you can't, because it won't cycle, because it's flow true only. So it won't flow. It's not compatible. It's not compatible. Whereas CPAPs, BiPAPs, Trilogy, Evos, anything that's on that auto track or auto track sensitivity, it'll pick it up. So Dr. Farber walked in, and somebody had put his patient on this. Now she has an older sister that's on the Trilogy. And he was livid. He said, I didn't order that. Because he came down because they were complaining that she was not cycling the vent. He goes down to see, well, who put her on this? I didn't order this. And Stephanie, my lead, she's bumped up to lead now since I've done doing this. I asked her, I said, well, what happened? She goes, well, he was pissed. I said, well, do you know who sent the order? And she goes, they just did from the, hospital. And she goes, now she's on the because she can cycle it. Auto track sensitivity. The newer of the Trilogy take it out of its little bag, and you have a regular filter. Okay, not like that one. Yeah, exactly. And it was the first event that had trilogy. There are two filters, and back when they last year they had a little over a year ago they had a recall on it, and the recall had nothing to do with the filters. Well, yeah, they did one filter, but not anything to do with that type of filter. So what did I do with my filter? All right, let's see. Here. So there are two filters, a foam filter right here, in the back here. Twist that off, and you got this pipe filter. This is your HEPA filter, okay? If that filter's not in there, it's gonna bypass, the dust will bypass this foam filter. And it will collect dust into the tract that the pressure goes through, right? Therefore causing it to go into a service required. So if you look at this filter, you're gonna see little holes, whatever, on the side. You can pass it down. If this isn't on it, that dust is gonna go through. So you have to have this filter on it. So now that filter is washable. This is changed. You have to change this out. We still give one of each filter a month, just in case. Okay. So, but yeah, that's the problem. That was the recall. Besides the upgrade on the software, which we have already just recently upgraded the software. So, but.
So this is what you're using currently?
This is Evo, the Trilogy Evo. This is what's replaced the Trilogy 100s. Back before they had all the recalls on the CPAPs and the BiPAPs. So that recall had to do with the abatement filters on the CPAPs and BiPAPs. Mm-hmm. That abatement filter is what keeps the noise down. Oh, okay. So what's happening, all of these CPAPs and BiPAPs that were being damaged and everything was due to those UV ray lights. You know, back when William Shatner said, nobody told me I had to clean my CPAP machine every day. That's so clean. Well, guess what, dummy? Yeah. You didn't read your manual? That's what I say. I mean, come on, I read my manual. So, Phyllis Esperonics shut them down. 2 weeks later, a woman gets on, and 2 days later, that commercial shut down. So, the abatement filters were being broken down because of those UV ray light. It was causing chemicals to leak to cause cancer. Less than 900 patients passed away nationwide. Wow. Less than 900. Over those thousands and thousands and thousands of CPAPs and BiPAPs that they were sending back. And they all found out is because, when they tested it was because of those UV ray lights. Came in and shut down and said you can't do a voluntary recall on the Trilogies and a mandatory recall on the CPAPs and BiPAPs because of the same filters. True, but they're placed different. Your humidification is not in your vent, it's on the side. You can't use these UV ray light things because it's a ventilator, not a CPAP or a BiPAP, right? Yeah. Okay. So last year, FDA cleared when they found out the whole truth and nothing but the truth. They let them continue to rework all of the Trilogies that they have. Either there are some that's older than the others, or redoing everything, redoing all of it on the inside. Yeah, and we're still putting out Trilogy. I have more patients on Trilogy still than I have anything else. Trilogies, Evos, these, and LTVs in that order. So we're still using them because they're still good. Why change something that's not broke? Right. Exactly. Okay. So you have to have that filter on as well. You're going to take it in. in. You're gonna twist it in, lock it in. Power cord goes right here. Just a basic power cord, and guess what? Yes, you can put this on a surge protection power strip. Oh, I know, right? You can't, this vent or this heater. These two have to go directly to the wall. Okay? But this, you don't have to, okay? So that's that. You see this part right here?
Mhm.
If you see this in the hospital, and they have an oxygen tubing, the oxygen green thing back there, that's what this is. We can actually take that off and put that big heavy duty screw in thing for oxygen for the hospital use. But we don't, okay? On this side, USB port for uploading or for downloading or upgrading. And we just upgraded recently because what it's given us now is an option to put the nub kit where it's at and it doesn't cause any alarms. So, okay, filter. Don't worry about these unless you have what they call an active PAP circuit. That's what these are for, or if they have a flow transducer with it. I've never used any of these at all, just a passive circuit. Okay, on this side, you have your detachable battery. Okay, which is charged. What I love about this vent, it's going to tell me how many hours are left on the batteries, not percentage. How many actual battery hours? I've had this go up to as much as 18 hours with this one battery and the internal battery. Okay?
18 hours?
18 hours, depending on the mode of ventilation. A USB, your cell phone to charge. That's not what it's for. It's an external alarm as well. That's all this is for. Why they did that is beyond me because I would have just glued it shut or whatever. So just don't do it because I caught a nurse doing that. None of y'all's nurse, but anyways. I asked her, I said, what are you doing? She goes, I'm charging my phone. I said, okay, you're charging a phone on a ventilator. Do you know that that's not what that's for? You want to go into service required on that vent? She looked, are you kidding? And I said, no, that's not what it's for. It's either to download or to upgrade because we can download through USB. Okay? This is also Bluetooth. We don't do Bluetooth. We want to go out and see the patient. We want to check the vent while we're there. Okay? That's what we want to do. Alarm, off and on. Let's see. Anything else I missed? Nope, that's it. Turn it on. Now I'm going to take Allison. I'm going to put her here. Now it's going to say new patient or vent, right? I can hit new patient. If I hit new patient, it'll give me all these prescriptions: nighttime, mouthpiece, transport, exacerbation, daytime, exercise, weaning, emergency, or other. So imagine having at least 3 or 4 of these. I do. Well, I don't have a pager, but one of my SMA kids from camp, 2 of them actually, had 3. Daytime, nighttime, and mouthpiece. So they can switch at any given time. Okay? So I'm exact, whatever. Oh, my battery. There you go. Come on, there you go. All right. So I'm at, right now it shows that I am in STA VAPS. Let's see. New patient. I want to go to patient. All right, here you go. Let's do daytime. All right. Tells you to check the filter. mode that you have to have pressure support mode. PS, AVAPs, kind of it's some really weird mode one of our patients has. So, but this is everything that you see: AVAP speed, rise time, flow trigger, auto track, or we can do auto track sensitivity or flow trigger. Auto track, breath rate, inspiratory time, tidal volume, maximum pressure, which is your maximum pressure support. Then you have your, maximum pressure control. Okay? Then you have your AVAP, expiratory pressure, PEEP, maximum and minimum on pressure support. This is the AVAPs mode. I'm not doing AVAPs. We normally do ST AVAPs or pressure support ventilation or AVAPs, or we can do mouthpiece, but a lot of times the AVAPs are going to be in the ST mode. Okay? So, got all that? Minimum and maximum IPAP, eye time, auto track, and flow trigger sensing, everything auto track. Okay? AVAP speed, rise time. This is an adult, so we can or breath rate. Do you know sometimes a patient has a lower breath rate? Rate on a breath rate. How many seconds? How many? Breathing treatment, whatever, suction, whatever, saline, whatever, okay? You may get one that's saying the patient's over breathing or whatever, and a lot of times it's probably because mucus plug again, okay? Whereas on the trilogies, you had a check circuit or a low circuit leak. Check circuit was this too, yeah. Low circuit leak was because the exhalation valve wasn't on, okay? Or it was turned upside down, or it was coated with secretions, okay? If they can't exhale out or inhale in, they're gonna retract and you're gonna start seeing numbers go crazy. All right? Questions so far? Nope. All righty. So whatever we do on those alarms, we always set a low and high respiratory rate alarm. Mainly low, because we don't have an apnea alarm set. All right? So we want to make sure that if they're not breathing, if they're not riding this vent at the respiratory rate that's set, then we know that they're not breathing and it's going to alarm low respiratory rate. To me, it's an alarm. Because you're not waiting 20 seconds or whatever. That's that T piece right there to go on by the circuit. Here, but if you go here, you can actually. Here, let me see if I can brighten this screen. It's on fire mode. Screen brightness. 1, 2, 3, 4, 5. Yeah, it's on the highest. Okay. I just want to make sure. So, okay. Their settings are here. Okay. If you want to see what their settings are, go to this little round thingy, and it'll tell you what all their settings are. Okay. And look, it's quiet. You can sleep. Okay. And then whatever they're doing here, you can tell. Spontaneous. If you see 0, because they're riding the vent. Once they start breathing more and more on their own, then it's going to spontaneous. It's going to go up. The leak has anything and everything to do with the trach and also with the exhalation valve, but mainly the trach. So if you're getting a high leak, check the trach. Is it positioned right? Is it cuffed or uncuffed? Okay, very important. You want, some patients have a cuffed trach, but it's uncuffed. And there's a reason for that. It's because maybe they want to increase their trach size, or they're trying to wean them off their trach. So,
When
okay.
it's cuffed.
If it's uncuffed, they're trying to wean them down to a smaller trach. If it's cuffed, it's probably because they want to increase their. Yeah, I have patients that's been on vents for years and years. They'll never come off of it. It is what it is. They'll never come off of it.
So can you change edit the settings, like how you can edit it on the V-Home? Or is it like locked in?
No, they're not locked. They're not locked in. You just got to go to this key here to see what their settings are. None of this is locked in. If you want to make a change, you just hit that and you just change. Yeah.
Are nurses allowed to make changes?
If they're my vent and it's my patient and you asking me, and if there's a prescription, absolutely.
Okay.
Yes. That's why I'm adamant about this. Okay, you can. Now it's up to the family too. Okay? But as long as there's a prescription. So let me tell you something though. If they are going to the doctor's office for a visit, pulmonary, and they're gonna make changes on the vent, they will do that there.
Okay.
And they have my permission. Whether it's the Woodlands, West Campus, Memorial Hermann, Texas Children's, it doesn't matter. They have my authorization to change the settings. I cannot just drop everything and go up there because they have a doctor's appointment. All right? I don't have time. Because one of you are going to go with your patient. Right? Exactly. So know what they're doing. And they will send the prescription changed by physician.
Okay.
And then the respiratory therapist will call you. They're supposed to. I don't know who you deal with, but my RTs are supposed to call when they see that changer come over. They're going to call and say we're going to do a follow-up just to make sure, or if you have any questions. Okay? But the doctors, for the most part, will make the changes themselves. They don't make changes and then put it back and then tell us to go out there and put those settings. It doesn't make any sense. All right? Change it themselves. From the settings to the mode of ventilation, whatever. That's what they will do. All right?
So when they change it, they lock it in.
It's not even locked in.
It just saves.
It's just saved. And even if you turn it off and turn it back on, it's already saved. Yeah. Now, down here, if you look down here, you're going to see 2 batteries. See, and right here it's unlocked. If I wanted to lock it in, you go up here, I can lock it in, just holding that. You would have to hold this down for 3 seconds to unlock it. Okay? You see the batteries there? That tells you right now, because we are on the detachable battery right now. So it tells you how many hours.
5 hours.
Yeah, 5 hours. And that's because I've been messing with it. But we do give extra batteries because it is hurricane season next month.
Okay.
So you should always have an extra battery or so. Okay. Also make sure your families have escape routes.
Yeah.
Okay. So, and just because they're on the vent doesn't mean they have to stay home. Okay. So, questions on this? Also, if you wanted to see the batteries again, if you hit there, there's a combination of both. Yeah. Right? I like the fact that you can change this any way you want to see it. So, if I want to view like that, you can even put pictures in here. But you'd have to put it, yeah, there are pictures in here, but you'd have to lock it, it'd go into a lock mode.
Okay.
And you would only get certain things. So if I wanted to do that, I can go to, let me go back to, here we go. There, device options. I'm gonna go to limited access. Okay. There you go. And I'm gonna go to prescription preferences. And I'm gonna hit this. See what I'm saying? That's the only thing I hit. Come on. Trying to get my picture up. There you go. So you can see if you wanted to add pictures. Any of these pictures. You can do that one, that one, that one, that one. Hold on, got more here. I know, right? For a background. Okay? You can choose any of those. Okay? So we maybe choose that one. Okay? I know, it's like you have to hit this a certain way. I got fat fingers. So I'm going to exit out. And this is what I see. So I can heat it that way, or I can do this way.
But it limits the view.
But it limits it, but the view. Yeah, but you see that picture. Yeah.
Oh, well, we don't need
So
pictures.
can you upload the patient's
We
picture
need the
there?
other one.
No, I wish. That would be great if you could, right? Upload the patient's pictures.
Yeah,
That would be cute. Yeah, it would. But this is the only vet that does that.
That even has
Yeah,
it.
Yeah, that
I
even
know.
has it.
This is
Yeah.
so cute.
Yeah.
I know.
I like it.
When they came out with these, I'm like, oh my gosh. It took me a year to figure out how to do that. I tried so many ways.
I know.
But when you got fat fingers like I do, and I know, I have them in my car, in my
I don't
office.
understand why they would make you without the card.
Yeah,
It's
you
not-
would
it's not
think
user-friendly
You
at
would
all.
think
Yeah.
you should have it.
every vent should have a card in.
Yeah.
Yes. Now, there is a battery, a couple years ago, last year, I was at a convention. Last year? Year before last. Before Burl was last year, right?
Mhm.
So I was in San Marcos for a convention, and this guy, they have these batteries for equipment like this that you can actually plug into and not have to worry about car or whatever. It's an external battery, but it's about this big and it's white. And you can run your concentrator, you can run your vent, whatever on it. Not all together, but one or the other. So hopefully when I go to Irving in August, hopefully that guy will be there because I want to really get them
That one could.
to where something works to help out.
Yeah, like a power bank, yeah.
Yeah, exactly, like a power bank, exactly. Because this right here, our batteries, we always have extra batteries. We're still working on trying to get extra batteries for this one. But this one in the Trilogy, we have the extra batteries. Even for the LTV 1150, we have the extra Sprint Pack batteries. Yeah, and car adapters. So, yeah. But I like the different modes of ventilation. I like the switching from primary to secondary to a third or fourth or fifth or sixth or whatever. I haven't had anybody do as for exasperation or weaning or whatever, but they do have them for daytime, nighttime, and mouthpiece for what they call a sip and puff. And Trilogies came out with those in 2009. Came out with that sip and puff, which was good. You put it in BiPAP mode and CPAP mode, and they can just without any alarms triggering. Yeah. And I like the fact that you can put this in a standby mode as well. Yeah. You can't, unfortunately, you can't on the Trilogies, but you can do it on these too. So.
Your humidifier, is it in a bag?
So a few of our patients are, but the majority of our patients are on this humidifier. So some of our vent patients are on that. But again, just trying to get Medline to bring down the price on them. You would think being with them for so long and this, but at least they're letting us have this vent in the home. Because technically it was a hospital vent, a hospital heater. But yeah, the only one that I know that's using it now in the hospital is Texas Women's downtown, the Women's Hospital. Yeah, because I'm also take on students from Lone Star College for respiratory. In fact, I've hired a few of them already over the years. Yeah. So they ride with me, work with me. You have a job if you want it. We did. That's how I have them. Yeah. I've been doing that since 2005.
Wow.
Mm-hmm. This was the first year in a long time that I haven't, the first semester in years that I haven't done it. Only because of me and my husband having surgeries and issues and all that. So hopefully in fall I'll have students again. So, but yeah, I like doing it. I mean, it gives them the opportunity to know that it's just not the hospitals anymore. Just like you all, just not the hospitals anymore. So. All right. Any questions on the V home?
So that view, you can bleed oxygen through.
Oh yeah,
Okay.
it's the same way. It's got that little bleed-in adapter in the back. Oh yes. Yeah. Oh, and on this one too, it has a. Let me turn this on here. I can do that fast. Okay. This one is a little slow. So on this one here, glad you said that. Let me turn this on so I can show you that it actually can do. It can count down how many minutes the nebulizer treatment is taking place. And it can also trigger if you're using a tank on your vent when you're going somewhere. It can also tell the oxygen. So if I monitor, menu, oh gosh. My oxygen. Is it this one here? No, not this one. Okay. Oh, battery use. Get over it. Okay, so menu. You see where it says here lock? This is how. Should have showed you this. What day and what time and what alarm happened. And the Evo has that too.
Okay.
This has it too. You need that for documentation. Okay, so that's what that is. Okay, exit out. Here you go. Let's do monitors, therapy. Oh, see therapy? You see external oxygen?
Oh, okay.
And here, if you're bleeding in oxygen with the tank while you're traveling, if that is on there, then you can do that and it will sense if the oxygen is out and it will alarm, okay? If you do the nebulizer, you can count down how many minutes, if you know about how many minutes it takes for a breathing treatment, it's gonna just alarm because in case you step away, at least you'll know how many minutes you have left for that neb treatment, okay? That's what that does, okay?
Oh, so you could set the timer.
Yeah, you can set a timer. And you're not setting the machine, you're just setting a timer. Right. And you're setting the oxygen here. So, all right. This is the only one that does it. I've never had anybody use the oxygen because to them it's just, they go by ambulance anyways. So, but the neb I like. That I do like. I think that's like a convenience right there for you guys. Yeah. Okay. Also, night mode. And you can put this in auto, where it will turn into night without unless you hit a button or alarm comes on. Like trilogies you can put in night mode or blackout mode, and if an alarm comes up or if you touch a button, it'll come up. Yeah. So, okay. Again, standby. You can do standby. Why would you want to use standby?
Oh, when you're changing parts out.
Right. Or something's
So you
going
don't have
on.
to turn it all the way off.
Right. But don't put it in standby mode and leave it for 3 or 4 hours. Turn it off.
Oh, okay.
Same with the Evo. You can do standby mode too, but just turn it off. Because we found out that if you keep it on, the longer you keep it on, it can actually eventually go into a service required, and we don't want that to happen. Yeah. An hour or two, that's fine, but if you're doing it all day, don't do that. And I know it's easier, but you know what? This comes out quicker than that. So
the standby mode is to give you like extra time or
to do if you're
something?
messing with the circuit, trying to get something hooked up,
Yeah.
maybe you need to suction.
Like a pause, like a
Pause
pause.
button.
Yeah.
Yeah. Yeah. Change the train. Right.
Okay.
Right. God, you guys are good. Seriously, you guys are really on top of it. Okay? Don't do that. Yeah, okay. I will. I don't have a problem with that. I will, yeah. I have a very good rapport with Dr. Farber, Harold Farber at Texas Children's. He comes to me for advice and I go to him for advice. I have since 2005. He's got me on speed dial.
Okay.
Yes, he does. He does. I've known Dr. Farber for years. He's the big wig for muscular dystrophy and SMA. Oh yeah. So him and he's neurology doctor Timothy Lotzi. His dad was my gynecologist. Yes.
Oh,
Yeah.
okay.
I know, right? Yeah. Yeah, exactly. I'm like, first time I met him, I said, you look familiar. He goes, outside. Never seen the guy before. And I said, you look like my gynecologist. of 6 later, some of we had Texas children, cats, only on the benefit. No, hold on, I'm done yet. So there 3 weeks, they got weaned off the ventilator during the day, only on at night naps. They go into the foster home. They're doing good. 2 weeks later, they're going to their doctor's appointment. And a trilogy because they're in foster care. Yes, I do put the apnea alarm on for a reason.
Yeah.
Okay, for a reason. Not just to irritate anybody, but for a reason. Because of what kids had to go through to get where they were at. And so they're having apnea alarms on the way home from the ambulance. They get home, they take them off the vent, which was fine. Put them on their HAs, which is fine. Home about 3 hours. Nurse goes to go for lunch. The other nurse leaves. That doesn't come yet. And their mom is watching them and not in the room with them. So the nurse comes eating lunch there at the house, goes in, notices one of the kiddos is not responsive. And this is the most active child. It's not responsive. Wants to go change the like what's going on with the kid and finds that the trick has been pulled out to the very edge. To the very edge. How long? I don't know. Right. And what do you think should have been on baby to monitor him? There you go, Paul Simmer. It was not on him. No, it was not on him. Okay? So they tried to put in step down trick too big. It won't fit in. So they go to bag him. They didn't cover this up. How are you gonna bag a patient with a mask and you're not covering this up? Okay. Child has a heart condition to begin with. Okay. Calls an ambulance. No AED. So instead of the ambulance taking them 10 minutes down the road to Memorial Hermann over off 59 here, 99. Okay. And waits for another ambulance who did not have an AED. By the time the third ambulance got there, he was already passed. They had to take him without this children in the West Campus to determine his death. And it was all because of that. Right. God just, he could have done it himself. He was a very active child.
Yeah.
He could have done it himself. But
The pulse similar.
the pulse oximeter would have done a lot quicker.
Yeah.
Guys, that pulse oximeter, I don't care what the pulse oximeter is very important when it comes to these type of kids. Yes. Right. It will monitor number one, a seizure. If they have the one that shows the waveforms, it will monitor a seizure. Mm-hmm. Low heart rate, low respiration.
Mm-hmm.
There are alarm limits on that.
Low oxygen.
Yeah, low oxygen. It will alarm. It will, right. Exactly. And that would have been fast. Right there. And they could have done something. So the one child that's taken out to another home, mom's and the nursing agency, big nursing agency. So now it's taken, not touch them. And the other little boy doing great. And they're ready to hopefully within the next year decannulate him. Walking, talking, and everything. But he was the one that was the weak one. Yeah.
Strong one.
Now he's the strong. Yeah.
So how did he end up in CPS?
Because the nurses got fired, and nurses called
They called CPS on.
saying that they were doing this, they were doing that, and but mom worked.
Yeah.
Dad worked. Yeah. Different. Mom worked days. Dad worked nights. CPS. Or of course the negligence on the CPS.
It's so good.
Right. Exactly.